Okay. So a couple of housekeeping items. If you're not speaking, please keep yourself muted. I will also be using my mute authority if needed. We do have a chat box for questions. Please feel free to enter your questions throughout the presentation. I do not expect that we'll be here for a full hour today, but we will stay as long as is necessary to answer whatever questions you might have. And if there are questions we can't answer, we'll follow up after today's session. This recording will go up on our YouTube channel, so you can share that with folks in your network. And I think that's all of the housekeeping. Yeah, that's it. Let's move on. So just by way of introduction, I want to talk a little bit about what EverThrive Illinois is, what our mission is and what our work looks like. And EverThrive's mission is really shaped by the fundamental belief that having and raising a healthy family is a human right. And our work is driven by the reality that not all families have the same opportunities and access to resources to thrive. For us, realizing this human right means that all people are able to have children if, when, and how they want, and that they can raise the children they do have in safe and sustainable communities. And for us, that's really where reproductive justice comes in. That is the definition of reproductive justice, which is a framework we've adopted several years ago to guide sort of our organizational mission, vision, values, and decision making. The reproductive justice framework was developed by Black women activists and calls on us to consider all of the systemic, societal, and cultural forces that may prevent someone from parenting if and how they want to. So this includes things like whether someone has access to contraception or abortion, which I think a lot of folks sort of routinely or regularly associate with reproductive justice. But it also includes things like, do parents, people who might want to be parents, children have access to safe homes? Do they have access to food? Do they have access to those other needs that allow them to parent if, when, and how they want? And that's really what brings us here today, right? So the reproductive justice anchors everything that we do at EverThrive. And because of that, a couple of years ago, I guess 2 years ago now, we updated our strategic plan to specifically have activities related to the creation of safe and sustainable communities. We do all of our work through kind of three main strategies: community engagement, capacity building. That's really looking at the institutions and organizations that serve people across Illinois, and our policy and advocacy. And so how are we using those strategies to build these safe and sustainable communities? And we've really looked at food access and specifically, which I'll get into later, support and promotion of the Women, Infant, and Children's Supplemental Nutrition Program, or WIC, as a way that we are ensuring people have what they need. So that's what we're here to talk about today, is to dig into kind of this whole idea of food insecurity and addressing hunger as reproductive justice. To root that conversation, Beth is going to talk about what hunger looks like in Illinois, who's affected, how we address hunger in Illinois, and then I'll talk a little bit about some of the work that EverThrive is doing. I realize I got a little bit ahead of myself in talking, so we won't go over this slide, but this is those strategic priorities I talked about: our values, our mission, and our vision. And there's Beth and me. Hello. And Beth, I'll turn it over to you.
Great, thanks, Kathy. So as Kathy mentioned, I'm Beth Kenefick. I am a senior policy advisor with the Greater Chicago Food Depository, and have both known Kathy personally and professionally for many years, and really excited about the work that we've been doing, particularly around the WIC Women, Infant, and Children program. With that, I'm going to share a couple of sad statistics around hunger in Illinois and in our community. So food insecurity in Chicago and Cook County. So we're Chicago's food bank, Cook County's food bank. So that's generally our service area. So you'll see that I sort of jump a little bit back and forth between Cook County and Illinois. Specifically with Chicago, we have 1 in 5 households experiencing food insecurity, and then 1 in 4 households with children is experiencing food insecurity. And this is Dr. Schagenbach's analysis and prediction based on the CPS and US Census. This slide talks a little bit about how high food insecurity rates are reflected in the number of household visits to the food depositories network of over 950 community food access sites and programs. It demonstrates that in FY 24, household visits remained elevated compared to prior years from like the pandemic, confirming the increased need for our food distribution and services. It hovered around 200,000 visits per month. And while not, um, and then we have a very wide reach. Our community pantries and open mobile programs served over 310,000 unique households at least once, which is around 52% of the low-income households in Cook County. Lastly, many of the new households come each month, so we get a lot of new visits, which shows sort of the ups and downs of food insecurity. Not surprisingly, there's disparities in food insecurity, and in our community here you can see the rates for Black, Latinx, Hispanic, all in white households, and that they're higher for Black and Latinx households than they are for white, and then same with households of those populations with children. This slide is both sad and exciting because it shows that hunger is a policy decision and there are things that we could be doing to lower food insecurity. So that green box, which we refer to as the safety net in action, that was during the pandemic when we had the expanded child tax credit, when we had enhanced SNAP benefits. And that showed that we saw a decrease in food insecurity overall and with households with children. Just checking to make sure there's nothing else. 2021, we had the largest drop in childhood poverty in a single year. The rate was 5.2%, the lowest ever recorded by the census. And we also see that households with children are more likely to be impacted, which is why we're here talking about the WIC program. Just quickly, the food depository, when we talk about our sort of goals and strategies to address and end hunger, we look at it in sort of three buckets. We try to optimize the emergency food access. So are all of our food insecure neighbors receiving an equitable amount of nutritionally balanced food? We talk about strengthening the safety net and maximizing access to publicly available benefits. And then we also think about, and this is newer for us, improving access to thriving wages and economic opportunity. If we truly want to end hunger, then we need to look at those root causes, such as wage inequality and paid leave and all of these other supports that can really lift up families and communities. In terms of what do we mean when we talk about that middle pillar, this is sort of a description of what the nutrition safety net is. You'll see it's broken down by the different federal poverty levels, so where the programs sort of start and exist. So the furthest left, which is under 130% of federal poverty line, which for a household of three is around $33,000 a year. That's where folks are eligible for SNAP, free child meals, WIC, senior meals, and the emergency food system. As you move further right and go up in the federal poverty level, you'll see that some of those benefits start to drop off. And so we change to reduced price child meals and eventually lose access to SNAP and WIC at above 185%. Which seems like a lot from a percentage, but when you look at what that means for a household of three, that means above $47,000, $48,000. And then this is a slide trying to represent what we're facing and what I have been spending a lot of my time with Kathy on in trying to go back against the different threats that we're going to see that we know are going to accelerate local food insecurity. So cuts to SNAP and WIC, and Medicaid at the federal level, harmful immigration policies, we know will have a chilling effect on people accessing these benefits. We're seeing in the last month tariff, trade, tax, and agriculture policies that are going to increase food prices, um, cuts to local and state funding. I know our state has already started to see that. And we've also already experienced some cuts to the emergency food system that the new administration has um, sort of cut back on food that we had thought we had already ordered and was coming.
All right. Thank you, Beth. Any parting thoughts before I start talking about some of EverThrive's work?
No, I mean, I think we'll get into a little bit of the WIC stuff when we get there. So,
Yeah. Thanks so much, Beth, and thank you for that overview. Again, for EverThrive, we've really, over the last couple of years, added in this strategic priority around creating safe and sustainable communities because we know it's important to address sort of health-related social needs and look at, to put it more plainly, people as they exist as whole people and make sure that folks have what they need in order to thrive to the extent, especially that that influences whether they are able to parent the way that they want. So I want to talk a little bit about EverThrive's work in this space. And like I mentioned at the beginning, a lot of our work around food insecurity thus far has really focused on WIC, or the Supplemental Nutrition Program for Women, Infant, and Children. And the reason for that is there's kind of twofold, right? One is that this is the food and nutrition program designed specifically with the unique needs of and priorities of pregnant and postpartum people and children in mind, right? So in terms of, for those who know EverThrive well, we've advanced over 40 now years from sort of a traditionally structured public health organization into this reproductive justice model. And so starting in this space makes a lot of sense for us. Um, the flip side of that is that WIC participation across all states, but especially in Illinois, is much lower than it could be. Less than 50% of people who are eligible for WIC are enrolled. That's true whether it's pregnant people, postpartum people, or children. So we know that this is an area that has a lot of opportunity to reach more folks, to improve program performance, all of those things, to kind of innovate and figure out how we can bring more folks in. This is also important because it's an effective program. We know that a lot of social benefits, even if they don't have a strong research base, are important, right? People deserve access to food. And so we should provide that, even if it's not the most efficient program. But this happens to be an incredibly cost-effective investment that improves nutrition and health of families with low incomes, which leads to healthier infants, more nutritious diets, and better health care for children, and subsequently to higher academic achievement for students, which we know, kind of to Beth's point, right? This like cyclical idea that part of how we address food security is to provide better access to economic opportunity and living wages. So WIC is an area where we've really kind of focused on expanding our work, leading and participating in more initiatives to increase WIC enrollment and participation using those three strategies that we know best of capacity building, community engagement, and advocacy. I'm going to talk just a little bit about this Making WIC Work project because it's a little bit old at this point. And then we'll spend most of our time talking about Project Up. And then I do want to spend some time talking about Medicaid, SNAP, and WIC defense. So, Making WIC Work Coalition was a coalition that we launched with our partners at Greater Chicago Food Depository, Start Early, Shriver Center, and maybe one or two other organizations back in 2017 to really start to look at this issue from our perspective of low WIC uptake and get input from our community partners, both those working in WIC sites, as well as those who might work with folks who are not enrolled in WIC or make referrals to WIC, and to pull in members, people who are community members, people who are using WIC or people who could be using WIC but are not, to really understand how the program is working and how the program could either work better or be better promoted or in some ways connect with the folks who are not enrolled. This was a really big effort that culminated in the issuing of a report in March of 2018 that laid out what we learned and several actionable recommendations to increase WIC uptake. I want to talk about this because of one particular accomplishment, which is probably the most important thing, which many advocates and community members had known about for a long time and been raising concerns about, that we raised through our report, was concerns around the discriminatory coupon system that used to be in place in Chicago for WIC. It meant that folks on the south and west sides of the city could have more limited access to places where they could use their WIC benefits to get food. This was something folks had been frustrated about for a very long time. It was unique to Chicago. And through the work that we did to develop a report, to work in coalition, in working with the state and working with partners, we were finally able in 2018, early 2019, to see the elimination of that coupon program. There were lots of other really interesting things happening. And then, of course, that was momentum. It feels like a weird word to use, but momentum into the pandemic, where the opportunity to use WIC creatively along with other systems in order to meet the tremendous need for folks in that disruptive time. So there was a lot of other stuff that happened following that, but the coupon change was prior to the pandemic and was something that our coalition really celebrated. Um, Another part of our recommendations was to really look at opportunities for collaboration between WIC and other types of services, whether that was with the Medicaid program or with early childhood providers, healthcare providers, like really looking at how WIC could meet people where they're at in order to increase enrollment. Because one of the things we heard is that some of the program requirements could be a bit challenging for folks, especially if they're juggling a lot of responsibilities. And so last year, we entered into Project Up with, again, Greater Chicago Food Depository and Start Early. This is a project of the Center on Budget and Policy Priorities designed to promote Medicaid and WIC policies that increase WIC enrollment. So looking at that collaboration between Medicaid and WIC. A lot of people who are eligible but unenrolled in WIC are enrolled in Medicaid. So finding those linkages and efficiencies is a really important strategy for helping families access and consistently take advantage of the programs that they're enrolled in. So we're in the middle of this project right now. I want to share one key accomplishment from my perspective, and then Beth, I would love for you to chime in and talk about this on the Greater Chicago Food Depository side if you'd like. But a big area of focus for us has actually been in the contracts for Medicaid managed care. So I'm sure most folks on this call know, but just in case, in Illinois, we administer our program largely through a system of managed care where the state contracts with independent agencies, a lot of the large health plans you've heard of, like Blue Cross Blue Shield or Aetna, as well as programs like County Care run by Cook County Health and Hospital System to actually sort of coordinate Medicaid benefits and networks. So the state is going through a very big deal rebid process. This is not something that happens regularly, but it presents an opportunity to really think about how Medicaid contracts can incentivize these plans to better promote a lot of different services that folks, especially the most vulnerable folks that they serve, need. So we coordinated some letters to the state. We coordinated some testimony at sessions across the state on the importance of linking between Medicaid and WIC and exactly what that could look like in terms of contract language and then how the MCOs actually operate. We're expecting that new contract language to be available this year, and we're kind of talking now about what kind of support and guidance we might be able to offer to the state or to MCOs, managed care organizations, as they rebid to then best enact our recommendations, whether they show up in the contract or not, using this as an opportunity while plans are reshaping what they do to really increase that connection between Medicaid and WIC. Beth, do you want to add anything about this project?
Sure. So I think that one has been sort of the most exciting and most concrete because it really made us dive right in, look at what was in the existing contracts, look at what is possible given the different data systems that are in place. Medicaid and SNAP both sit in the integrated eligibility system, but WIC enrollment and applications happen somewhere else. And so really we're able to get down into the nuts and bolts and start to map out what is possible. At the same time that the state is rebidding those contracts, they're also implementing what's considered an 1115 waiver. So they received approval from CMS last July to sort of introduce flexibilities to the Medicaid program, specifically around health-related social needs and addressing those, of which food insecurity is one. And so they've proposed looking at helping folks with chronic conditions, people with high-risk pregnancies, and sort of high utilizers of Medicaid, and supporting them with things like prepared meals, prescription grocery boxes, medically tailored meals, as well as trying to improve um, their enrollment in existing federal programs like SNAP and WIC. And so there's a little bit of a push and a hope that this is going to spur activity and a lot of that sort of data sharing in the back end. To Kathy's point, of a lot of folks are on Medicaid that could be on WIC, and sort of how can we and find those people, tell those people that they are eligible? Is it something that the managed care companies could have that information? Is it something that the state could text? Could they help, actually help enroll them, et cetera? And so sort of along for the ride with the state while they think through a lot of that sort of data matching that hopefully could make some really exciting increases in enrollment in these programs, especially at a time when we are seeing food insecurity rates continuing to go up.
Thanks, Beth. And I think a theme, both of the Making WIC work sort of work, as well as Project Up, and so much of the other work that our organizations do is really thinking about how do we improve these programs by making them less difficult for folks to access, right? So whether that's improving the actual application system themselves, improving the process by which people redetermine for benefits, or just kind of like bringing this information to them. That has been a really big focus of Project Up, is how do we use this connection between Medicaid and WIC, and some of the stuff that's happening in the state right now to just try and get this information to people where they're already at. So it's been a really exciting project. We've got a couple of months left at least to kind of see where else we can make inroads. We've also been thinking about we've done a lot of work over the last couple of years to expand access to birth workers and postpartum supports through Medicaid, including doulas and home visitors. So we've been thinking a little bit about how we can partner with that workforce to make sure that the doulas, the home visitors, and others who are connecting with people who are pregnant or newly postpartum, make sure that they are also kind of aware of these programs, how to access them, making referrals, making that process a little bit easier. The flip side to that is the context this is all happening in. Of course, when we started Project Up, we knew that a presidential election was coming, but we continued to push on with that project, and we still do, but it's all happening now in the context of massive proposed cuts to the health and social services safety net. So again, for those who somehow are not aware, I'm going to give you my really short summary of what's happening. And then I do want to leave everybody with a call to action on how you can stand up in support of these programs and some really specific activities. So in order to pay for tax cuts for the wealthy and large corporations, $7 trillion worth of tax cuts, uh, congressional leadership has proposed massive, massive cuts to the healthcare and social services safety net. And we are in the middle of that fight right now. In fact, we're getting into the most intense and most critical stage of that fight. Among the cuts that they've proposed is $880 billion to the Medicaid program. And while we're here today talking about food insecurity, we've talked about all of the connections between these, and I do want to talk about Medicaid briefly. Medicaid insures 3.4 million people in the state of Illinois. That's 20% of our population. That includes half of our children, half of our pregnant people. So it is a vital program by which folks get access to healthcare, but also, as we've talked about, it serves as kind of an inroad to a lot of other social supports. A cut of $880 billion at the federal level would be devastating to the state, no matter how they enact that cut. You're going to hear a lot in the next couple of weeks about reductions in the federal match, work requirements, provider taxes, like oh, who knows what else, right? We're going to see some, I think, interesting messaging. We know what the cuts will look like, but we're going to see interesting messaging from leaders in Congress who want to enact these cuts. It all amounts to people losing benefits, people losing access to the Medicaid program, because the state of Illinois cannot make up for cuts to that level. No state could. EverThrive and 99 other partners across the state, including the Greater Chicago Food Depository, through the Protect Our Care Illinois Coalition, are working to lead the defense of healthcare programs, and that has a spillover effect for some of these other programs, right? We've really had a kind of broad message of supporting what communities need and not making cuts, especially to fund tax cuts for the wealthy. There are three things that need to happen right now. Our members of Congress will be back in DC starting next week, and they are going to start putting together their very specific proposals. If Speaker Johnson has his way, the House will advance a package to gut Medicaid, SNAP, and other supports by Memorial Day. Our job is to be really vocal in our opposition in order to insert doubt into that situation and slow that process down. Every day we can delay a vote in the House is a day for us to save these programs, whether that happens by killing the bill in the House or killing the bill in the Senate. So, we want folks emailing right now since they're not in DC. If you want to do something today, email your member of Congress. I will put these links in the chat. But emailing your member of Congress is, whoops, I'm not going to do that while I'm presenting. Sorry, guys. But we will follow up. So emailing your member of Congress is the best way right now. We are going to do a statewide call-in day on Tuesday when members are back in DC. So we'll make sure that folks on this call get that follow-up, because those phone calls, I know everybody's telling you to make phone calls right now and the phones are overloaded, but that's because they are incredibly powerful. And we are seeing in our work, especially with Republicans from Illinois, that the calls are making a difference. On that note, the next thing you can do is volunteer for our weekly Protect Our Care Illinois phone banks. We have 3 Republican members of Congress in Illinois. Republican votes are the ones kind of most important for stopping this, right? If we can flip a couple of Republicans, then this bill dies. So we are contacting people who live in the districts, the Republican districts of Illinois, to educate them about the proposed cuts and ask them to, if we can patch them through to their member of Congress to voice their opposition for those cuts. Super easy. We do it from noon to 1 on Fridays. The dialer, all you need is a computer. It dials for you. You can do other stuff while you wait for someone to answer. I've joined several of these, and it's probably the friendliest phone banks I've ever done in my life, because the polling shows, our experiences show that people do not want to see their neighbors or their family or themselves losing access to healthcare. So they're pretty amenable to the conversation, and we've been able to patch a lot of folks through. We've made over 15,000 calls and connected almost 300 people to just Congressman Darren LaHood. We're almost through Darren LaHood's list, and then we'll be moving on to the next Republican. And finally, we need help telling the story of Medicaid. The most important thing that we can do, whether that's, I've already said calls are the most important. Another really important thing we can do is to make clear how our communities will be harmed and who in our communities will be harmed, and telling stories is the best way to do that. So Protect Our Care is collecting stories of folks who are enrolled in Medicaid in Illinois, or providing care for someone enrolled in Medicaid. If someone wants to share their story, they fill out this survey in the turquoise box over here, teal box, and they'll be contacted typically within 12 to 24 hours by a storytelling trainer from the AIDS Foundation of Chicago. They'll participate in 2 Zoom sessions, 30-minute sessions. If technology is a barrier, we can work around that. And they will work with that storytelling trainer to tell their story and then to develop 2 deliverables, a written story and a recorded story. We are then sharing those stories with members of Congress, with the public through our social media, and with the press. If folks are uncomfortable with any of those things, they can tell us. We don't have to share it with all three. Folks can also tell us that they want to be contacted for future opportunities to share their story, for example, at a rally or press conference. If people complete their 30-minute sessions, 2 30-minute sessions, and we get those two deliverables, then they receive a $50 Visa gift card for their time. AFC has a considerable budget for this. We need a lot of stories, and we have the support to do that thanks to the Health First Communities Fund, which supports Protect Our Care Illinois. So please help us to spread the word and connect with as many folks as possible. The one thing we ask is that you don't put this link on social media because that's how the bots find us. And thank you, Beth, for putting these links into the chat. Whoa, where'd my mouse go? That is the end. Any questions? I know we've kind of gone over a lot in a short amount of time. That is somewhat the goal of these webinars, but it always feels like a lot when we get to the end. So I'm happy to answer any questions. I don't see any in the chat, but I can vamp for a minute if somebody's typing. I appreciate you all for your time, for coming out to hear more about this. I hope you have a better understanding of why this is an issue that EverThrive is working on and some of what we're doing, especially in partnership with great organizations like Greater Chicago Food Depository. As I said, the recording will go up on our YouTube channel. Happy to share this with anybody. Thank you for your kind comments in the chat. Thank you so much for your time. I think we are all done. Thank you, Beth, for presenting, and we'll talk to you all soon.